Hey guys, today I wanted to shoot a quick video going over a few things I tried with a patient who was having issues with wall balls. During the wall ball, I noticed that the patient's heel was popping up on the side that he was having pain. So we were going down into the squat position, up. As we were coming down, there was a slight hip shift and the heel was popping up on each attempt. So my first thought was ankle mobility. So we assessed the patient's ankle mobility in half kneeling. So we got towards the rig, half kneeling position, tried to drop the knee over the second toe towards the rig, and we're trying to get about 4 to 5 inches away from the rig to show that you have proper ankle mobility to get into that deep position of the squat. Now he actually had great ankle mobility, so this was not the issue. Since the knee joint is a hinge joint and it only goes in 2 directions, flexion and extension, I typically like to look at the hip as well to make sure that there's no limitations there that are causing the knee pain. Now with this patient, what we did is we looked at the Faber test. This is something we did as a table test, but if you wanted to do it on your own, this is a little hack that you can try. So typically the height you want to be able to get your knee from the ground is about hand and a finger, which is about two plates. So stack 2 plates, you'll cross your leg over top of the other leg, lay back, and have that knee drop down as far as you can get it. Now typically you want that knee to be able to touch the height of the 2 plates. As you can tell, I'm a little limited there. So was our patient, so that is something we wanted to really work on to try to loosen up the mobility within the hip joint. After figuring out that the hip joint was something that was limited and something we really wanted to work on, I gave our patient 2 exercises. The first one was just a simple hip opener drill. So leg that's bothering you, affected leg, you're going to walk out into this half kneeling position. You can get a kettlebell, hold it in front of you, either in a down position or a goblet position. But the goal is to drive that knee directly over the second toe, leaning laterally into the position. Hold for about 5 seconds, and then move back into it. Now, if you have enough mobility and that feels good, you'll slowly start to move your leg further and further out. The second exercise we added was an assisted hip airplane. Now, there's a couple different ways to do this. I like to do it with a bar and getting a bumper plate on the end, just because you can get a little bit of that rotation without having to keep your shoulders from moving. And this exercise, the biggest thing we're looking for is trying to work on stability through full opening of the hip and then closing of the hip joint. So what you'll do is you'll stand outside of the barbell with the bumper plate on there, single leg RDL, holding onto that bumper, trying to open up the hip as far as you can, hold for about 5 seconds, and then you will slowly reverse and back to the middle. So that's an assisted hip airplane. So after adding these 2 exercises to the patient's accessory program that he was doing before his CrossFit workouts, and then a few sessions of manual therapy and some retraining of the movement patterns, basically his knee pain cleared up. Now there was other structural issues going in there, but we worked around that, and due to the improvement in the hip mobility, the knee pain was no longer an issue during squatting or wall balls.